Welcome to this video training for volunteers of Train the Trainer Oral Health. I am Elaine Vivens, Coordinator for the Children's Oral Health Coalition, led by Cook Children's, and I will be your guide today. But first, let me share some background information on who we are. The Center for Children's Health, led by Cook Children's, is home to children's health data, research, and community outreach. The center's goal is to create partnerships that will make the North Texas region one of the healthiest places to raise a child. To provide prevention and intervention services for children's health, the Community Health Outreach Department partners with the community through coalitions. One of these coalitions is the Children's Oral Health Coalition, created in 1999 to improve the oral health of children 0 to 8 in Tarrant County with a special focus on underserved children. Did you know that tooth decay is the #1 chronic disease in young children and it's preventable? There are an estimated 17 million children in America who go without dental care every year. Looking at local data, in Tarrant County, on a household survey done by Cook Children's in 2015, 60% of parents taking the survey did not know the correct age of 1 year for their child's first dental visit, and they did not connect that dental health can affect their child's general health. To help educate families and organizations about children's oral health, we developed Train the Trainer. One of our main objectives is to increase our network of oral health advocates. In the Train the Trainer, we provide training and oral health information to community professionals who then share that information with the families that they serve. Train the Trainer Oral Health is a free 4-hour workshop designed for community professionals in Tarrant County who work with pregnant women and low-income families with young children. The workshop introduces the basics of oral health in a small group setting and is taught by a dentist or dental hygienist. The goals are to improve knowledge about children's oral health, demonstrate effective teaching methods, and increase confidence when educating families about oral health. Once the training is completed, participants become what we call oral health ambassadors with access to a teaching toolkit, oral health lessons, and ongoing communication with oral health information and resources. We rely on volunteers to help with each Train the Trainer workshop. Children's Oral Health Coalition members help host each workshop. The dentist or dental hygienist have gone through a special speaker training to teach the workshop, and table leaders help facilitate a table of 5 to 8 participants. This video is specifically for those interested in or signed up to be a table leader. Table leaders are strongly encouraged to attend the 4-hour Train the Trainer workshop prior to volunteering as a table leader. The workshop is presented in 5 modules. The table leader will help build on the learning experience by leading guided activities, reviewing key handouts when talked about, and engaging the participants. One of the first and most important responsibilities of a table leader is to greet and welcome each participant at your table. This will set the tone for how everyone interacts with each other throughout the workshop. Some examples of setting the tone is to be cheerful and upbeat. Be interested in who they are. Ask questions about what they do and why they are attending. Introduce them to other people at the table. You can also point out the food, where the drinks are, where the restrooms are. Here's a short video clip of one of our seasoned table leaders sharing a tip about setting the tone.
The biggest tip that I would have for those who are going to be table leaders would be to be as welcoming as possible to those who are volunteering to take this program. That will just foster an entire environment of them being open to asking questions, to learning new information, if you just make them feel incredibly welcome. And a lot of times I don't have that much in common with them, but what I do have in common is I appreciate that they are willing to learn something new and to go out and educate someone else about that information.
Let's go over a few activities that you will do at the table. The right-sized toothbrush is an activity where the table works together to match the toothbrush to a certain age of child. You will spread the toothbrushes and chart out on the table for everyone and get them started. Remind them to think about the size and shape of head and bristles, size and shape of handle, and the size of the child's mouth. Let them work through it without solving it for them. This will allow for greater learning. After a few minutes, ask them why they chose the toothbrushes for each section and point out why an adult toothbrush will not work for an infant or toddler. The speaker will also demonstrate how to position an infant or young child for brushing their teeth using the one or two-person position. The table leader will encourage everyone to practice with the big dental puppet at the table. Start the puppet around the table to practice the one-person position. When doing the two-person position, participants will need to pair up. These are pretty quick activities, so keep the puppet moving around the table. Another activity around oral health and nutrition involves using Go Slow Whoa cards to identify healthy food choices. This is a fun, interactive activity that participants seem to really enjoy. Go Slow Whoa uses the traffic light concept to help teach healthy food choices. Green light are go foods that can be eaten every day. Yellow light are slow foods that can be eaten once or twice a week. Red light are whoa foods that are only eaten on special occasions. The table leader guides the discussion by asking why a food is a go, slow, or whoa, or how a slow food can become a go food, and how a whoa food can become a slow food. There may be questions that come up during the guided activities that you aren't sure how to answer. Please pull me or the speaker over to help out. Many times it's a great question that we want to address with the whole group. In wrapping up, I hope you have a better idea about the role of a table leader. If the participants are having fun while they learn, they will get more out of the training. Even though I've been through this training a dozen times, each group is unique based on experiences and questions, and I learned something new each time. If you're helping at an upcoming Train the Trainer workshop, you will receive a confirmation email with the date, time, and place. If you are not signed up but are interested, please contact me and I will get you set up. Thank you so much for taking the time to view this training. Your willingness to be a part of Train the Trainer ends up helping many children in Tarrant County. I'm going to leave you with a video clip from a recent Train the Trainer participant sharing her reaction about the training. Thanks again.
And it's also going to make my job better because I have what I need and I'm more confident because it was like hands-on today, and everybody asked questions that probably you wouldn't ordinarily ask. It was so comfortable. It was a comfortable setting. So I really appreciate all of the information that we have to give out along with the education. So thank you so much. Oral Health Coalition. Appreciate it.